And in terms of behaviour change, what was the initial impact of the campaign and what was the longer term impact?
The aim of the campaign was to improve awareness and make sure people had the facts, to also try and change behaviour so that people would reduce the number of sexual partners they were having, or they would always protect themselves and practice safer sex. So I think that in the early days we knew from, we had an AIDS monitor who sort of regular waved research that looked at those
survey research
figures, looked at knowledge, attitudes and behaviour. So we could see that people were claiming that they were having less partners, and that condom use, condom sales were going up remarkably. Now that has that was sustained for quite a long time, and obviously I think condom use, particularly amongst young people, is now a feature. But I think those kinds of measures are very susceptible to to peaks and troughs again. And I think that the problem is now, for the newer generation, HIV and AIDS really has not got the kind of gravitas that it had 20
it seems
years
to be a historical
ago.
problem.
That's
rather
right.
Than a current one.
And really the focus for young people is on sexually transmitted infections, other ones other than HIV, and on pregnancy. So it is a constant challenge to keep up the pressure, the information, and to get people to take care of their sexual health.
How did the campaigns carried out in the UK compare to those carried out in the rest of the world?
Well, I think that the UK campaigns were extremely prompt and had lots of funding behind them, so they were large scale. And certainly the campaign for gay men was one of the very few government-backed campaigns. I think that in other areas it differed enormously. Obviously in places like Switzerland, they went with condom advertising from the very beginning, had they have a much more consensus approach to these things than we do, and their kind of whole attitude was make love with condoms, war against AIDS. So the whole approach was a focus on not on high risk groups or people, but generally on the message. In some of the other European countries, as I've said, they used humour much more, and they focused people like the Dutch, that immediately they're very pragmatic, none of the sensibilities around sex or whatever, and focus straight away on sex workers, on drug users, getting the information to them very quickly, and being very explicit about what they were saying. So I think that the approaches especially across Europe, were very different.
We did have a very different approach, didn't we? Because the Department of Health in 1994 vetoed an AIDS campaign promoting safer sex on the grounds that it was too explicit. So there is, as you say, something in the British psyche.
Yeah, and I think that there was also, there have been events over the course of the campaign where that has happened, and I know that there was an agony uncle who produced a guide in the early 90s, a very well researched guide, but it was written in language that young men would use, and I think that was felt to be just over the top and not something that government money could fund. So there's always been this kind of fine line as to what is acceptable and what's not, and what organisations like the HEA used to always say is that it's based on evidence. We know what will work, and if you're going to put messages out, then you need to do it in a way that's going to be acceptable to your target audience. And if you're using street language and using language that might not be used in the House of Commons, is the way forward, then that is the imperative, really. Sometimes you win the argument, sometimes you don't.
And what other lessons do you think have been learned in general for this kind of health education campaigning from a campaign of this scale?
I think that you need to choose your medium wisely. I think that the pressure was always to look for television, because that's where the noise is created, and that's the sort of easiest way to raise awareness. But that's not always appropriate depending on what message you're giving out. So I think you have to, know your target audience well, know exactly where they pick up their messages, whether it's online now, social media is enormous these days. Had we been starting the campaign now, we would have taken a very different approach. You have a much more immediate, direct channel to your audience. So I think that, you just need to be aware of the audience, of where they pick up messages, and of what kind of tools you can use to make sure the message hits the right place, really. But that, you've got to look at sustainability, and the cost of advertising these days is enormous, particularly in times when money is tight, and where service provision is being affected. So you have to balance the kind of, what is more effective and what is better value for money, focusing on the service provision or focusing on the sort of messaging. So I think there is such a lot of good evidence there for other public health campaigns, because one of the things was, because it was a government campaign, it was so well documented. The data around it is so rich, and I think it's been used for other campaigns, so it's sort of stood the test of time.
But are the days of the high intensity, large spend health education campaigns over, maybe? Given
I certainly think it would have to be something fairly dramatic that you wanted to communicate, because I think there's so many channels these days. Focusing on one where you're having a big hit out to millions of people, but not a very kind of targeted message is really I think would only work in certain circumstances. I think that the range of media these days is so varied that you would probably look at a more diverse range with various different messages, where you can speak to your audience more intimately rather than through the television or radio.
Helen, thanks for talking to me today.